Hi, I'm Dr. Parisa Rezaiefar. I'm an assistant professor at the Department of Family Medicine, University of Ottawa. I will be talking to you about incontinence as part of the pelvic health video series. Incontinence or involuntary loss of urine can impact a person's well-being and lead to isolation. With proper care and support, you can manage incontinence and improve your well-being and social function. Incontinence can be divided to two main types, the stress and urge incontinence. A small group of people experience both symptoms. We call that mixed incontinence. Let's go over stress incontinence first. It happens when physical movement or activities such as coughing, laughing, sneezing, running, heavy lifting, or having sex puts pressure on your bladder, causing you to leak urine. If you think of your bladder as a hammock and the tissue around it as the cords from which the hammock hangs, and the uterus, abdomen, and chest as the load of the hammock, you can better understand the causes of stress incontinence. Substances such as smoking, caffeine, and alcohol affect the integrity of the bladder, i.e., the hammock. Nicotine and caffeine irritate bladder muscles. Alcohol and caffeine are diuretics. Childbirth, abdominal obesity, chronic constipation, lung diseases caused by smoking increase the load on the bladder and pelvic floor muscles, the hammock bands. If these changes happen very quickly, you need to see your primary care provider to make sure a rapidly growing tumor in your pelvis or abdomen is not causing this. If these changes are happening slowly, you can do a lot while waiting to see your primary care provider, like exercising regularly, monitoring your weight, and certainly reduce alcohol, coffee, tea, and smoking. There are many excellent online programs that can help you with Kegel exercise. Kegel is an exercise that strengthens pelvic floor. Urge incontinence is a sudden intense urge to urinate, followed by an involuntary loss of urine. You may need to urinate often, even during the night. If you experience a rapid change to your need to urinate, like over a few days, and that you are experiencing pain or burning on urination, you need to see your provider urgently and make sure you don't have a bladder or a genital infection. If the changes happen slowly over time, you may consider your diet first and then see your primary care provider to make sure you don't have diabetes or conditions in your pelvis that may cause these symptoms. How does one develop urge incontinence? Well, again, age, estrogen deficiency from menopause, cancer treatments, or estrogen suppression in trans men can impact the bladder muscles. Substances such as smoking, coffee, and alcohol affect the integrity of the bladder. Limit your use of alcohol, caffeine, carbonated drinks, and sparkling water. Artificial sweeteners, chocolate, chili peppers, foods that are high in spice, sugar, or acid, especially citrus fruit, and large doses of vitamin C can cause urge incontinence. There are many excellent online programs that can help you with bladder drill or bladder training exercises, which help the bladder muscles to become less irritable or overactive and help you manage your urge incontinence.